Hey there, Simon here from Hogan and Mitchell, and in this video I'm going to be showing you why the hip raise exercise is absolutely brilliant for back, hip and knee pain relief. Check it out. Okay, so for this exercise you're going to basically sit down on the floor. The floor's better than the bed, but if you're not happy getting down onto the floor, the bed is fine. And you're going to lie down on your back with your feet and your knees about pelvic width apart and heels relatively close to your butt. From there, you're just going to relax yourself, and basically all you're going to do is think about your butt. So you're going to push through your feet and lift your bum and your hips as high as you can. So the aim is you can try and get your thighs in line with your torso. Once you're up, relax your neck and shoulders. That in essence is the hip raise. Now, if you were doing it for back pain, right, or back pain relief, you might do a repetitive movement to get some relief from more acute pain. So from here, you might try and put down the back of your ribs first, then your lower back, then your pelvis. So I'll just do it once more. So you're going to push up high through your hips, relax through your neck and shoulders, peel down through the back of your ribs, into your lower back, one bone at a time, and then peel off through your pelvis. So that repetitive movement can be really good for acute pain relief. Now, if you're someone who's got kind of persistent pain and it's been going on for a while and you want to get some relief, and this does actually work for acute back pain relief, but that's another story altogether, you can go up into your hip raise and you can stay there. So you can use it as a back muscle endurance exercise. Now, if you think about what position your back is in, it's in a straight position, the same as when you stood. So basically in this exercise, your butt muscles and your back muscles are having to tense or work, if you like, and basically keep you up in the air. So they're making sure you work, but without putting your back into generally a provocative position. So once you're there, stay there. You can count for 10 seconds. If you can't stay there very long, you can work up to 20 or 30 seconds. When you're done, you just come back down, have a wriggle, okay? Otherwise you can get a build-up of tension within your back muscles, okay? So have a bit of a wriggle, and then when you're ready, go up, okay? So you repeat that for maybe if you're doing a 20-second high, you might do 5 reps, for example, and you can make it harder. So if you want to progress it, you can make it harder by putting a weight across sort of your pelvic or your pants line. Now, that's for back pain. Now for hip pain, it's great as well. So it makes all of your butt muscles work. So everything in your butt, but it also makes everything around the front work. So predominantly for your butt, but it will make all the muscles around your hip work. So how would you do it differently? Well, not really at all for the first one. So you would just go up and you would hold it. So that's a basic hip exercise for all the butt muscles. Predominantly it works glute max, which is the biggest, rather than the outer ones here. It works this one around the back, but that could be a basic hip strengthening exercise. Now, if you wanted to make it harder, you can do that in a couple of different ways. So you could either go into a one-legged raise, so you can do it like this, and again you could hold it, that would be your starting or opening salvo if you like. And then as you got better at it, and as you got kind of happier to do more, then you can work on coming down and then pushing all the way back up. So the push is through here on the front part of the hip, and you're thrusting up, holding, controlling down. So you'd repeat that on that side. So the affected side and painful side is the one you're working on. And generally when you're working on stuff around the pelvis, you try and get both sides working, but obviously a bit more work towards the side that's painful. Now the last thing to say is it can be really useful for people who get knee pain who struggle with something like squats, for example, and their knees too painful to squat. So what they would do is actually go into exactly the same position, and they would go up and they would hold that position. Now if you feel your thighs, if you put your hand down and tap on your thigh whilst you're doing this, you actually feel that your thigh muscle is very tense. So it's a way to try and load the knee, to get the knee doing some work around the patellofemoral joints in particular, and through the tendon, patellar tendon and quads tendon, without you getting too much pain. So most people with knee problems can do this without getting too much knee pain. If you still are, there are other alternatives, but give this a go first of all. And what we normally say to people is, ideally it's not painful, but if it is a bit painful, as long as it settles down relatively quickly when you stop exercising back to the pre-exercise level, then you're actually good to go for it. So there you go, a hip raise in a few different ways. So you've got it for back pain relief, you've got it for hip pain relief, okay, which involves strengthening your hip, and also if you've got an acutely painful knee that's not very happy to squat and do things, you can also use it for that. So there you go, the hip raise in a nutshell. Have a go, see how it gets on. Like and comment below. And of course, if you click this button over here, you can click subscribe. Thanks for watching. I'll see you soon.